Hello everyone, this is Dr. Kim. I'm here to explain what a cavity is. So, for some of you, you may have gone to the dentist and the dentist could have told you you have no cavities, which is awesome. Good job. If you have one cavity, that's still fine. Two cavities, or in some cases, the dentist might tell you have 10 cavities, which really scares you because, you might wonder, how did I even get these cavities? So, I got this picture from Wikipedia. I want to credit my source. So in the outer layer, it's called enamel, okay? And that's almost like a crystal layer. So what happens in cavity is basically, I want to put it in simple terms. So there's bacteria in your mouth, okay? There's actually a lot of bacteria in your mouth. Now, what happens is if you have sugary things, it sticks to your teeth and the bacteria gets on it, and actually bacteria eats the sugar and everything and then produces, it sounds gross, but poop. So they're pretty much pooping on your teeth. And what happens is that when they poop, it's like an acid, so it starts to break down the crystal, which is the enamel. So what happens is that when you brush your teeth, microscopically, that little bit of crystal that was has eroded, it can actually go back. It can actually build back. That's why it's important for you to brush your teeth. But in the case that if you have such a frequent sugar to the point where, yes, you are brushing your teeth, but the rate at which is occurring, you're just getting more of that enamel getting a hole. So cavity is because it's like a hole. And then once it reaches the dentin, that's like the biological layer, okay? And now that has your cells, and what's going to happen is that once the bacteria makes that initial breakthrough to the dentin, we really call it decay, because once it starts to inhabit there, the bacteria just continues to inhabit that area, and what's going to happen is that that bacteria should not be in your tooth, within your tooth. It can be outside in the enamel part of it, but it cannot be in there. And what's going to happen is that if it's once the bad bacteria reaches to the dentin, that it's really irreversible unless the dentist goes in and drills the tooth. So if the bacteria goes into the dentin and if it continues to penetrate, it's going to go into the pulp, which has nerves and blood vessels, and you start to get pain and aches because the bad bacteria has penetrated into the pulp. And now, what does your body try to do? If there's a foreign substance, well, it's technically living in your body, but it shouldn't be within the tooth. If that happens, your body is going to try to fight it off, and it's going to produce a lot of white blood cells, and it's going to try to fight it off, and that's why you have infection. Sometimes that infection you can see it as an abscess, in which case you need a root canal or extraction. So all in all, what cavity really is, it's like a hole that starts because of the bad bacteria. And that's why with the sugar intake, I mean, I like sugary things too, but what's important is that try not to have it so frequently, because if you just have it once a day, for example, and then if you brush your teeth right away, that acidity and it's gonna be fine because you brushed it off. But it's the frequency so if you have a constant consumption of that sugar in your mouth, that's really gonna help the bacteria out, and it's going to have a lot of food. It sounds gross, but it's actually pooping because it produces lactic acid after it consumes that sugar, and just going to penetrate the enamel layer, goes into the dentin, and if that's not treated, then it's the pulp. So generally, dentists, we can detect, I would say if it's close to the dentin, then some dentists might just get it out, which is completely reasonable as well, because it's almost there, so you just want to clean it out before it gets bad. So that's what a cavity and a filling is. Hopefully that helps. And if you have any questions or concerns, please comment down below. I will do my best to read everything and also answer questions as well. So I really share this with your family and friends, and education is really important. And actually, one of my goals is that as a dentist, honestly, is like the patients that I see, my hope is that they don't get cavities ever again. And to me, that's why education is so important, because, someone can have a cavity, I can fix those things, but if we're not changing the actual source, which is the oral habits as well as brushing and flossing, if that's not happening, it's going to happen again and again. So honestly, my goal is to educate you so that you don't get cavities ever again, hopefully, and that way you can save a lot of money as well. And yeah, so if you have any questions, let me know. Please hit the subscribe and the like. Appreciate that as well. Thank you. Have a nice day. Bye.